Health officials say an increase in Flathead flu cases might be due to the resurgence of a bug that we haven't seen for a few years. Flathead County has already seen more than 300 cases this season, making it the most in the state. MTN's Jack Ginsburg shows us how Flathead County is dealing with the spike in the virus and how hospitals are trying to prevent it.
In October, the first flu-related death in the state was reported here in the Flathead Valley. And now, around 3 months into the season, Flathead County has seen 332 cases reported, the most in the state. And the weekly flu report from the Montana Department of Public Health and Human Services reported 89 new cases of influenza in the county in just a 1-week span, from January 7th to the 13th. Flathead County Public Health Officer Hillary Hansen says although numbers have been high, it creates an awareness in the community that otherwise may have never been there.
It's really good that we're being aware of that fact in Flathead County, which also probably means we're becoming more cognizant to when we should have prevention methods in place.
While speaking to Jason Cohen, the chief medical officer at North Valley Hospital in Whitefish, he said the spread of influenza has been irregular this year, but thinks it could be because of the strain of the virus.
H3N2 is one that we haven't seen for a little while, so when you see the same flu strain year after year, populations develop more of an immunity. When it's a flu strain that's more virulent, like this one seems to be, and one we haven't seen for a while, it's going to travel more quickly to the population.
Cohen says that the prevention efforts at North Valley are the same no matter how rapid the flu is spreading, but says that they have partnered with Kalispell Regional Health Center to discuss what to do if we saw epidemic levels.
Talking about what we would do if we saw surges of patients like they've seen in California. So we have alternate buildings we can use, for example, to see patients if our ER is overwhelmed.
And while hospitals are trying to cut back on the traffic coming in and out of the facilities, they've created an easy way to diagnose your symptoms through an app called KRH Care Anywhere. The app allows you to connect to a physician over the internet or phone to diagnose and give you advice about the sickness you may have, all from the comfort of your home. Cohen says the app's ability to let someone stay at home has been very useful during this flu season and helped contain possible transmission of the disease in the community. Jack Ginsburg, MTN News, Kalispell.
And with this spike of flu cases across western Montana, the Missoula County Health Department has tips on how to prevent catching this contagious virus. Infectious disease specialist Pam Whitney suggests the best thing that we can do is practice good hand hygiene. She says washing our hands more than normal during this time of year will help. And another tip, keep alcohol-based sanitizer nearby and wipe down all surface areas frequently. And if you cough, cover your mouth with your sleeve or elbow and have some tissues ready to use. Lastly, Whitney says the flu shot is an extra step towards protecting ourselves from the flu. And there are many people who do receive the flu shot and still get sick, but she says it's because the H3N2 flu strand has already mutated after the vaccine was made.
In March is when they put the vaccine together. And so they always look at the southern hemisphere when they do that. So the strains that were circulating there is what went into the vaccine. And it was an H3N2 strain, but between March and now when we started seeing the cases, it changed a little bit. So that's why we're seeing people who got the vaccine not quite being protected.